When I heard this statistic, like up to 80% of all women develop some type of fibroid by age 40, I found it mind-blowing. Why is that so weird? The last thing a woman wants is a hysterectomy with all the side effects, not to mention a fibroid. So I pulled some strings and found something fascinating to share with you, fibroid causes and associations. So let's first take some clues about fibroids. Number one, they actually decrease after menopause. That's interesting. So why would that be? Well, it's probably related to estrogen, right? We're going to get there. When a woman goes through pregnancy or is exposed to HRT or birth control pills, there can be an enlargement of the fibroid, which sounds like it's also related to estrogen. Then we have the relationship between obesity, type 2 diabetes, high blood pressure, and polycystic ovarian syndrome, all increasing the risk of fibroids. Why is it that black women are 3 to 9 times more at risk for getting fibroids? And of course, the common theme with this is estrogen. Estrogen is a growth hormone. It's a primary driver of fibroids and endometriosis. What is a fibroid? Let's look at what a fibroid is. Uterus tissue. What is a uterus? It's a muscle. So the difference between a fibroid and a uterus is that a fibroid is a growth from the uterus and it grows out of the uterus tissue. In a fibroid, it's very non-elastic. There's a lot more collagen in a fibroid, which is why it's hard. There are some very interesting differences between a fibroid and the uterus. In a fibroid, you have a much greater sensitivity for estrogen, which means that a fibroid is very sensitive to estrogen. Okay, it can grow a lot faster with estrogen than the actual uterus. A fibroid also has more receptors for estrogen. There's also more of this enzyme called aromatase going on in a fibroid. Now, what's aromatase? That's an enzyme that converts androgens, which are more for men, to estrogen. The environment in this fibroid has a lot less oxygen than the uterus. That's called a hypoxia environment. We'll come back to that. Lastly, what's unique about a fibroid is that it has a lot more inflammation than the uterus. So here's the question. What do low vitamin D and fibroids have in common? All of these clues have one common thread, and that is a low vitamin D situation. Now, regarding research in this area, which I'm going to cover in a little bit, there's mixed reviews on research with vitamin D. I really think that has to do with the frequency and the amount of vitamin D that they give people in certain studies. The amount of vitamin D needs to be a lot greater than the usual vitamin D that's given to people, because most of the studies are operating off of this old, outdated information that we need a very small amount of vitamin D, like 600 to 800 IU. And all that research is mainly for bone and skeletal calcium and not the immune system, the uterus, the prostate, the skin, the brain, the muscles. This is a completely different system that needs a lot more vitamin D. Vitamin D benefits. Vitamin D will inhibit the growth of fibroids. Number 2, vitamin D also helps regulate other growth factors as well. Since we're dealing with a fibroid, we're really dealing with something that's out of control as far as growth. Vitamin D also is an aromatase inhibitor. It blocks that enzyme, preventing excess amounts of estrogen. Vitamin D increases apoptosis, which causes the fibroid cells to commit suicide, preventing the growth of a fibroid. But vitamin D also is anti-inflammatory. Anytime we have inflammation, we can have growth of a tumor or even cancer. Well, guess what? Vitamin D is the most potent anti-inflammatory someone can take. This is also interesting. Vitamin D doesn't seem to work in an environment where there's not enough oxygen, a hypoxic environment. Now, the very nature of a fibroid is creating this low oxygen hypoxia because it's so dense with irregular collagen and things like that. So this could explain why normal amounts of vitamin D won't even come close to dealing with or penetrating this fibroid in doing anything. You have to use much higher amounts of vitamin D. Vitamin D downgrades estrogen. There are 2 different receptors for estrogen. One estrogen receptor increases tumor growth, and the other one, called estrogen receptor beta, decreases or shrinks the cells that are actually turning into a tumor. Well, guess what? Vitamin D supports this one that helps shrink it and inhibits the other one that is making it grow, which is very cool. Also, vitamin D helps to increase a certain hormone in the liver to help lower the amount of free estrogen that's throughout the body. So if we look at this whole situation, estrogen is the primary driver, but we don't have the brakes, and that is vitamin D. Simply because the majority of the population is deficient in vitamin D, especially black people and black women. Why? Because of the melanin in the skin, which blocks vitamin D. And so here we have this population which is already low in vitamin D. And then they actually have these spikes of estrogen. they're going to get more fibroids than people who have enough vitamin D. Now let's take a look at obesity, for example. Obese people are always deficient in vitamin D because vitamin D gets diluted into the fat cells. So an overweight person needs a lot more vitamin D because it gets diluted and it's less effective. Now, as far as type 2 diabetes, there's always low vitamin D. High blood pressure, I think the majority of that is low vitamin D. That's really behind high blood pressure because if you give a person more vitamin D, their blood pressure goes down. And then, of course, you have polycystic ovarian syndrome. That's a situation where we have way too much insulin. Now, this is very interesting information because it provides a solution to a very common condition that occurs with up to 80% of all women. But I do not think you can create a dent in this problem unless you take enough vitamin D, and I'm going to get into this. But I first want to just talk about a few studies involved and also some anecdotal case studies that I want to share with you next. So the question is there research on vitamin D shrinking fibroids? Well, it's a bit mixed, but I want to show you why it's mixed, and I'm not going to show you some of the positive results right now. There was a study in 2013 in Reproductive Science that showed a significant decrease in the size of fibroids within 12 weeks when taking 25,000 IU of vitamin D3 once a week. Now, if they took that every day, I think the results would be even better. Here's another study in 2014 on African American women, and these women had low vitamin D in their blood. They found a high percentage of women with fibroids have a lower vitamin D level than those who had a higher level of vitamin D in their blood. They gave them 50,000 IU of vitamin D3 every 2 weeks, and then in 10 weeks they saw a significant decrease in fibroid size. And I'm even surprised that they saw those results because taking it every 2 weeks is just not going to be sufficient. You want to take it every single day. Here's another study by C. Vantini. These are women who took vitamin D, and they found the group that took the vitamin D did not experience any fibroid growth versus the other group who didn't take vitamin D, who had a 40% increase in fibroid growth. In vitamin D3, doctors even discourage women from taking 10,000 or 20,000 or even 50,000 vitamin D every day because somehow it's toxic. Yet the research shows that you'd have to take hundreds of thousands of vitamin D3 for months to create any toxicity. And really the only toxicity is excess calcium in the blood causing kidney stones. But you can even greatly minimize that side effect by taking magnesium, vitamin K2, drinking a little more water, 2 liters of water a day. Those are all the cofactors that will minimize that toxic effect. Personally, I think that if you're taking 50,000 IU or less, you're not even in that range of having any toxicity. So I really think there's enough data to seriously consider taking more vitamin D as well as the cofactors to potentially do some positive things about shrinking fibroids. But I think with a lot of things in the news, with scares about vitamin D, it's very important to get all the details, especially with the scare of a toxic level of vitamin D. Thank you for watching this video, and if you like this, then do not forget to subscribe the channel.